Which of the following arteries is most commonly used to assess an adult's pulse during CPR? A. Radial artery. B. Brachial artery. C. Carotid artery. D. Femoral artery. Answer: C. The carotid artery provides the most accurate pulse during CPR because it is large and centrally located. Peripheral pulses like the radial may not be palpable during cardiac arrest due to poor perfusion. When performing a capillary puncture, which order of draw is correct? A. Lavender, green, gold. B. Blood gas, lavender, green. C. Gold, lavender, gray. D. Blood gas, green, lavender. Answer: B. The correct order for capillary collection is blood gases first, then EDTA, lavender, followed by other tubes. This prevents contamination and ensures accurate hematology results. A patient reports taking herbal supplements. The medical assistant should first: A. Document the supplements in the medical record. B. Discard the supplements. C. Advise the patient to stop all supplements. D. Ignore unless prescribed. Answer: A. Documenting herbal supplement use is critical because some herbs interact with prescription drugs or lab tests. Accurate documentation supports safe clinical decision-making. The chain of custody process is most critical when: A. Collecting urine for drug testing. B. Drawing fasting glucose. C. Taking vital signs. D. Performing a throat swab. Answer: A. Chain of custody ensures specimen integrity for legal or forensic purposes. Each handler must document specimen transfer to prevent tampering or misidentification. Which of the following is considered a HIPAA violation? A. Discussing a patient's diagnosis with an authorized provider. B. Sharing patient information with a coworker not involved in care. C. Securing medical records in a locked file. D. Providing information to a patient's healthcare proxy. Answer: B. Sharing patient information with unauthorized personnel breaches confidentiality under HIPAA. Access should be limited to individuals directly involved in the patient's care. A 12-lead ECG shows large, wandering baseline artifacts. The most likely cause is: A. Improper lead placement. B. Patient movement or poor skin contact. C. Low paper speed. D. Cardiac arrhythmia. Answer: B. Baseline wander often results from poor electrode adhesion, movement, or inadequate skin prep. Ensuring clean, dry skin and proper placement eliminates interference. Which injection angle is correct for subcutaneous administration? A. 10 degrees. B. 45 degrees. C. 90 degrees. D. 30 degrees. Answer: B. Subcutaneous injections are given at a 45 degrees angle to ensure the medication enters the fatty tissue beneath the skin without reaching muscle tissue. A patient's blood pressure is 180/110 mmHg. What should the medical assistant do first? A. Repeat measurement and notify the provider immediately. B. Record it and recheck next visit. C. Tell the patient to rest for an hour. D. Administer antihypertensive medication. Answer: A. A hypertensive crisis requires confirmation and immediate provider notification. Prompt action prevents serious complications like stroke or cardiac arrest. Which additive is found in a lavender top blood collection tube? A. Sodium citrate. B. EDTA. C. Heparin. D. Potassium oxalate. Answer: B. Lavender top tubes contain EDTA, an anticoagulant that binds calcium to prevent clotting, used primarily for hematology tests like CBC. Which is the correct procedure for cleaning a venipuncture site before drawing blood cultures? A. Alcohol only. B. Soap and water. C. Povidone iodine or chlorhexidine. D. Hydrogen peroxide. Answer: C. Blood culture sites require thorough antisepsis with iodine or chlorhexidine to avoid contamination and false positive bacterial growth. The correct needle size for an adult intramuscular injection in the deltoid is A. 25 G, half an inch. B. 21 to 23 G, 1 inch. C. 18 G, 1.5 inch. D. 26 G, 5/8 inch. Answer: B. A 1-inch, 21 to 23 gauge needle is ideal for adult deltoid IM injections to ensure the medication reaches the muscle without causing injury. A patient with diabetes reports dizziness and sweating. The MA finds a glucose of 54 mg per deciliter. What is the priority action? A. Give water. B. Provide a quick carbohydrate snack. C. Call 911 immediately. D. Have the patient lie down. Answer: B. Hypoglycemia requires prompt administration of fast-acting carbohydrates like juice or glucose tablets to restore normal blood glucose levels. Which of the following represents proper sterile field maintenance? A. Reaching over the sterile field. B. Opening sterile items away from the body. C. Turning back to the sterile field. D. Touching sterile gloves to a non-sterile surface. Answer: B. Opening sterile packages away from the body preserves sterility. Reaching over or turning your back risks contamination and compromises aseptic technique. When preparing to administer ear drops to an adult, the auricle should be pulled. A. Down and back. B. Up and back. C. Straight outward. D. Forward and down. Answer: B. Pulling the auricle up and back straightens the ear canal in adults, ensuring proper delivery of the medication to the eardrum. Which of the following is an example of a CLIA waived test? A. CBC. B. Urine dipstick test. C. Throat culture. D. Point/INR. Answer: B. CLIA waived tests are simple and have minimal risk of error, such as urine dipsticks or rapid strep tests, commonly performed in ambulatory clinics. During venipuncture, if the patient becomes pale and diaphoretic, the MA should first A. Stop the procedure immediately. B. Continue to complete the draw quickly. C. Elevate the arm. D. Call security. Answer: A. Signs of fainting or vasovagal response require stopping immediately to prevent injury. The MA should assist the patient to a safe position and monitor vital signs. When documenting in the medical record, a correction should be made by A. Erasing the error. B. Covering with whiteout. C. Drawing one line through and initialing the correction. D. Removing the page. Answer: C. Proper documentation corrections maintain transparency and legal integrity by crossing out the error once, adding initials, and recording the correct entry. The first step in sterilizing surgical instruments is A. Autoclaving. B. Washing and decontaminating. C. Wrapping for sterilization. D. Dry heat application. Answer: B. Instruments must be thoroughly cleaned and decontaminated before sterilization. Residual debris can prevent complete sterilization and lead to infection. A medical assistant suspects a coworker is stealing medications. The appropriate action is to A. Ignore the suspicion. B. Confront the coworker privately. C. Report the concern to a supervisor. D. Contact the patient. Answer: C. Reporting suspicions to a supervisor ensures proper investigation while maintaining professionalism and legal compliance with workplace policies. A patient refuses treatment after being informed of the risks. The MA should: A. Proceed with treatment. B. Notify the provider and document refusal. C. Attempt to persuade the patient repeatedly. D. Have the patient sign a consent form anyway. Answer: B. Respecting patient autonomy is crucial. Documentation of refusal and provider notification protects both patient rights and legal accountability. The primary function of the hypothalamus is to: A. Control blood pressure. B. Regulate body temperature and hormones. C. Filter waste from blood. D. Produce digestive enzymes. Answer: B. The hypothalamus maintains homeostasis by regulating temperature, thirst, hunger, and endocrine activity through the pituitary gland. Which instrument is used to examine the interior of the eye? A. Otoscope. B. Ophthalmoscope. C. Laryngoscope. D. Speculum. Answer: B. An ophthalmoscope allows examination of the retina and optic disc for early detection of ocular or systemic diseases. The prefix tachy- in medical terminology means: A. Slow. B. Fast. C. Irregular. D. Absent. Answer: B. Tachy- denotes rapid activity, as in tachycardia, fast heart rate, contrasting with brady-, which means slow. A patient is instructed to collect a 24-hour urine sample. The MA should explain to: A. Keep the first voided urine and discard the rest. B. Discard the first voided sample and collect all urine afterward for 24 hours. C. Store at room temperature. D. Mix with preservatives manually. Answer: B. The first sample is discarded to begin timing. All subsequent urine is collected for 24 hours to ensure complete analysis of renal function. Which body system is primarily assessed by pulmonary function testing? A. Circulatory. B. Respiratory. C. Nervous. D. Musculoskeletal. Answer: B. Pulmonary function tests evaluate lung capacity and airflow to diagnose conditions like asthma or COPD. The correct abbreviation for nothing by mouth is: A. NBM. B. NPO. C. NOM. D. NPM. Answer: B. NPO stands for nil per os, nothing by mouth, indicating the patient must not eat or drink, often before surgery or procedures. The universal safety color for biohazard containers is: A. Yellow. B. Blue. C. Red. D. Green. Answer: C. Red containers identify biohazardous waste like sharps and blood-contaminated materials, ensuring proper disposal and infection control. A patient weighs 154 pounds. How many kilograms is this approximately? A. 60 kilograms. B. 70 kilograms. C. 77 kilograms. D. 80 kilograms. Answer: B. 1 kilogram equals 2.2 pounds, 154 divided by 2.2 almost equals 70 kg. Accurate conversion ensures correct medication dosages and clinical calculations. What is the normal range for adult respiration rate? A. 8 to 12 per minute. B. 12 to 20 per minute. C. 20 to 30 per minute. D. 25 to 35 per minute. Answer B. Normal adult respiration ranges from 12 to 20 breaths per minute. Deviations may indicate respiratory distress or metabolic imbalance. When performing a venipuncture, the tourniquet should not be left in place for longer than A. 30 seconds, B. 60 seconds, C. 90 seconds, D. 2 minutes. Answer B. Prolonged tourniquet application can cause hemoconcentration and alter lab results, leading to diagnostic errors. The term cyanosis refers to A. Redness of skin, B. Bluish discoloration due to low oxygen, C. Yellow pigmentation, D. Skin peeling. Answer B. Cyanosis indicates oxygen deprivation and appears as blue or purple discoloration, especially around lips and nail beds. In the event of a chemical spill on skin, the MA should first A. Apply disinfectant, B. Flush the area with water, C. Cover with sterile gauze, D. Rub with alcohol. Answer B. Immediate rinsing dilutes the chemical, minimizing tissue damage. Further care depends on the specific substance involved. The purpose of the SDS safety data sheet is to A. Describe patient rights, B. Provide chemical hazard and safety handling information, C. Record employee hours, D. Explain billing procedures. Answer B. SDS documents list handling, storage, and emergency measures for hazardous chemicals, ensuring workplace safety compliance. When performing a urine dipstick test, the MA should A. Immerse and read results immediately, B. Time results per manufacturer's instructions, C. Shake off excess urine vigorously, D. Let the strip dry completely before reading. Answer B. Each reagent pad must be read at specific time intervals for accuracy. Early or late readings produce false results. The apical pulse is located at A. Neck, B. Wrist, C. Fifth intercostal space at midclavicular line, D. Behind the knee. Answer C. The apical pulse, assessed with a stethoscope, measures heart rate directly from the left ventricle apex for accuracy in irregular rhythms. A patient scheduled for fasting blood glucose admits to eating breakfast. The MA should A. Proceed with test, B. Note the error and notify the provider, C. Ask patient to skip lunch, D. Delay results. Answer B. Food intake invalidates fasting results. Notifying the provider prevents inaccurate readings and misdiagnosis. The preferred site for an IM injection in an infant is A. Deltoid, B. Vastus lateralis, C. Ventrogluteal, D. Dorsogluteal. Answer B. The vastus lateralis muscle is safest for infants because it avoids major nerves and provides good muscle mass for absorption. Which of the following PPE is required during venipuncture? A. Gloves, B. Mask, C. Sterile gown, D. Shoe covers. Answer A. Gloves protect both patient and MA from bloodborne pathogens. Additional PPE may be required depending on exposure risk. A patient's pulse oximeter reading is 89%. The MA should A. Report immediately to the provider, B. Record as normal, C. Turn off device and retry later, D. Ignore unless symptomatic. Answer A. Oxygen saturation below 90% indicates hypoxemia. Immediate reporting allows prompt medical intervention. Which of the following requires immediate incident reporting? A. A dropped sterile instrument. B. Late appointment arrival. C. Delayed billing. D. Minor documentation error. Answer A. A dropped sterile instrument compromises patient safety and must be reported for corrective action and replacement to maintain aseptic standards.